So the two tracts which is connecting the spinal cord to the cerebellum, what are those? The name is dorsal spinocerebellar tract. If you remember the lamina where I taught you, I talked about the Clark's nucleus, the Clark's column, the nucleus dorsalis. I told you that this is the neurons which are going to give, they're going to give rise to the dorsal spinocerebellar tract. So let me trace you the dorsal spinocerebellar tract. Okay. So let me just magnify this. Fine enough. Now we are here. So spinocerebellar tracts are actually, what are they carrying? What type of sensations? They are carrying the proprioception. So let me tell you, we talked about proprioception in the dorsal column tract also. What is the difference between that and here? There, it was a conscious proprioception, okay, where your cortex was well aware of the change of the position or the position of your body. But these proprioceptions, these fibers which are going to go through via the dorsal spinocerebellar or ventral spinocerebellar, they actually are going to carry the proprioceptions from the muscle spindles, joints, tendons, ligaments, but your cortex is not much aware of them. So it's the cerebellum which is aware of it, and that cerebellum makes a correction of it, and it's well aware of your position of your body. Okay, so here this type of proprioception, we call it as subconscious, unconscious proprioception. Unconscious means your cortex is not alert about it. So cortex is not aware of it, but cerebellum is aware of it. So you're not having a conscious awareness of this. So for this tract again, what are my receptors? The proprioceptors, which are present in the muscle spindles, joints, tendons, ligaments. So they also pass, they give their first order neuron at the dorsal root ganglion. Then they go into the lamina, okay, where there is the Clark's column, okay. So they go to that level, and then what do they give? They give the second order neuron. So see that for dorsal, they go via this, they go via this area. And now they are ascending up as a dorsal spinocerebellar tract. How about the ventral one? The second order neurons from the Clark's column, they cross over, they cross through the commissure, they cross over, and then they go to the ventral column. And from the ventral column, they ascend up as ventral spinocerebellar tract. Okay. So dorsal spinocerebellar tract, they have the afferents from your muscles, from skins. They enter the spinal cord via the dorsal root ganglion at the level, maybe at the T1 level, at the thoracic and the lumbar level. And they synapse and they give the second order neuron at the Clark's column. We have seen it. Now this second order neuron, it ascends up to the medulla. The connection between the medulla and the cerebellum is via inferior cerebellar peduncle. The pons and the cerebellum, they are connected by middle cerebellar peduncle, and the midbrain and the cerebellum, they are connected by the superior cerebellar peduncle. So via the inferior cerebellar peduncle, this dorsal cerebellar tract, via the inferior cerebellar peduncle from the medulla, they go into the cerebellum, into where? Into the paleocerebellar cortex. Now, how about my ventral cerebellar, spinocerebellar? See, it has crossed over, right? The ventral spinocerebellar tract, the fibers, the second order fibers, they have crossed at the spinal cord level. They ascend up. They go into the medulla. Then what did they go? They go to the pons. Then they go to the midbrain. From the midbrain, via the superior cerebellar peduncle, they actually cross back again to the cerebellum. So actually, there was, there is no use of crossing over. They actually had crossed at the spinal level, spinal cord level, but again, they did not go to that contralateral side. Rather, they crossed back again, and via the superior cerebellar peduncle, they entered into the cerebellum. Okay, so this is about the spinocerebellar part.